Going to launch that. Meeting to order, please, and begin with the roll call.
Commissioner Nieder?
Here.
Commissioner Fauci?
I'm here.
Commissioner Eichelberger?
All right. Is there any public comment that anyone would like to make at this time? Lauren, do we have anyone online? Okay. Having none, going once, going twice. We will move on to the approval of the minutes of the April 10th meeting.
I'll move to approve the minutes.
Second.
It's moved and seconded. All in favor, say aye.
Aye.
Aye. Unopposed. We will launch into the 4 topics of discussion that we have on the agenda today. And first is a letter of support for the Carlisle Chamber. And it looks as though we have Nicole on the line.
Hello,
Nicole,
everyone.
You'd like to give us a few words on this?
Yes, please. Thank you so much for the time and consideration. But yes, the Chamber is applying for the COVID-19 ARPA Capital Projects Fund Multi-Purpose Community Facilities Program. Say that 10 times fast. But we are in a unique position. We got some LSA grant money with COVID that ironically Tucky is in the building working on right now, giving us some energy efficiency. But with a 100-year-old building, we are in need of a new roof. And it is I believe, a slate alternative. We thought it was original. It is not. But we also just discovered it has asbestos in it, which only adds another layer of cost to the project. So this is a unique opportunity for the Chamber because we do offer broadband in our building and health screenings, and we are a public entity and our members are able to use our building. We have a unique opportunity to apply for funding that would not only help repair the roof, but also our rotting front porch. It would add some additional lighting to our parking lot, which would make it safer for staff and people using the building. And then we also have a lovely hole in the back parking lot that needs to be filled, or else it will expand over time. So while I love this historic, beautiful building we're in, it can often sometimes feel like Tom Hanks in the money pit. And so we were just trying to find creative funding resources to help us finish this project and maintain the building and its integrity so that the Chamber can do what it needs to do for our members and the community. So it is with that we simply ask for a letter of support to be included in this grant funding application that is due Saturday, but we are hoping to submit it on Friday.
Thank you very much. Would anyone like to make any motion or have any questions of Nicole? No questions from us? Would you like to make a motion? Please.
I will move to approve the letter of support for the COVID-19 ARPA Capital Projects Fund Multi-Purpose Community Facilities Program for Carlisle Chamber of Commerce.
Oh.
Moved and seconded. All in favor, say aye.
Aye.
Aye. Thank you. Thank you, Nicole. We'll get that off to you.
Thank you very much. Appreciate the time.
Next up, we have another discussion and a potential approval for a letter of support under the same program, this time for the Fredericksen Library. And I believe we have Jessica on the line to discuss that application as well.
Thank you so much for having me. My name is Jessica Miller. I'm the director of the Fredericksen Library in Camp Hill. It's funny, I started about 3 years ago. And since I started, what I heard from all of the patrons and from the staff is that we have an amazing facility. We had over 500,000 items checked out last year. We had 200,000 visitors, but they don't have a place to go to do any sort of telework or any sort of teleeducation or telehealth privately. We provide Wi-Fi for all of our patrons, but if they have something that they need to do where they might not want to be into a large group, there's not really a place right now for that. It was funny the other day, it was a couple weeks ago, I think, and I had a patron who was in a little cubby that was taking part in a work meeting. And anyone in our public computers could hear exactly what was going on because we don't have that private ability right now. So we were so excited when this grant had popped up. I will say it's the same grant as the prior contestant, that way I don't have to spell it out. And because it really is designed to help provide for those facilities. And so we're looking to apply. We're looking to add some smaller community facilities, as well as split one of our larger ones with a convertible partition. Do you have any questions?
Thank you very much. Does anyone have any questions of Jennifer?
Don't.
Oh, I'm sorry, Jessica.
That's okay.
Hearing no questions, I entertain a motion.
I will move to approve the letter of support regarding the COVID-19 ARPA Capital Projects Fund Multi-Purpose Community Facilities Program for Fredericksen Library.
Is there a second?
I will second.
It's moved and seconded. All in favor, say aye. Aye.
Aye.
Thank you, Jessica.
Thank you.
All right, next up, we have a discussion and potential approval for Rowan Miller, do a DBA Rowan's Tree Farm contract for planning, and that would be Elizabeth Grant. Is she in the room or online?
I'm online.
Wait, where are you, Elizabeth?
I seem to be having a little technical difficulty today. Sorry about that.
Yeah,
Yes.
there you are. See ya.
Good afternoon. So for your consideration, we have a contract addendum with Rowan Miller. This is for a fencing project, one of 3 fencing projects, which were funded by the Department of Environmental Protection, Countywide Action Funding. And this is an increase of $44,102.50, and also an extension of the contract term through June 30th of 2024. The increase was necessary due to some additional fencing that was required to comply with the NRCS grazing plan for this farm. And all of the increase is able to be funded by the grant.
Perfect, you answered my question.
Thank you.
Did anyone, any questions of Elizabeth at this time? Hearing none, I'll entertain a motion.
I'll move for approval of the contract as stated.
A second.
It's moved and seconded. All in favor, say aye.
Aye.
Aye. Thank you, Elizabeth. All right, next up, we are going to have a fiscal budget discussion roundtable with a number of groups. So I'm not sure how you all want to do it or how.
I'm going to start and then I'll call on the department so they can give you.
Perfect. And I think that we have some of the information here. I don't know if there's anything supplemental that we need at this time. Okay.
So we have fiscal departments here to talk about their programs and any major changes. Just a reminder with fiscal budgets that they are based on estimates from the state, and children and youth is a needs-based budget. They'll be going on view May 9th for approval on June 6th. So we'll get started with the departments. Aging, can I go first? Or community sector? If not, we can move on to.
Good afternoon. There will be no more American Rescue Plan funds as of June 30th for us, so it's their final year. In the governor's proposed budget, aging had a $10 million increase in there. This is in addition to the $5 million last year that the AAA's received. There is currently a wait list of roughly 30 consumers due to no available providers who are willing or able to serve to provide such limited hours per week. We have seen increases in the majority of our services, specifically protective services, ombudsman, options, and meals. We have seen an increase in the cost for our providers, meals, and transportation. The current fare for transportation in the year 2023 cost us $138,000. With the increase for the same number of trips, it would be $174,000. Currently, in Cumberland County, all essential trips are covered for anyone 60 or over. We are discussing with the advisory board on Friday the potential of adding a copay for those 60 to 64 for all essential trips. We also want to start charging no-shows for their fullness trips. It will be brought to the Board of Commissioners after advisory board input and approval. We are utilizing grant funding to complete our first Echo Cottage and are currently looking for a consumer for the program. We continue to provide the other services as needed. Our assessments continue to increase, and starting in April, we'll see a slight increase per assessment. We will no longer be the regional coordinator for ADRC. However, we are in discussions with the state to provide ongoing fiscal administration for the program and would receive an administrative payment to do so. Do you want me to go to community services?
Sure. Yeah.
On the community services side, there's no anticipated increase in the upcoming state budget for the Human Services Development Fund or Homeless Assistance Program under the Human Services Block Grant. The temporary food program allocation will remain the same. The state food purchase program has historically seen a small increase with each budget passed, but we won't know until the governor passes the budget.
Anything from the Human Services Development Fund?
There's no. All of it.
Annie, was there any indication given on how the 10 million in the governor's budget for aging is going to be divided up, or what their priorities are for that?
There were comments that it would be divided up the same way the 5 million was, but they also are discussing redoing the interstate funding formula. So I don't know if that would impact what we would receive or not.
So there's no way of projecting any sort of, Chris, I see Christine shaking her head. No, we have no idea to know if that's going to be a positive for us or not at this juncture. Okay.
Thank you. Drug and alcohol? You want to go next?
Sure. The governor's proposed budget for drug and alcohol is flat funding. That makes it at least a decade that there's been no increase in state funding for drug and alcohol. However, for several years now, there has been additional federal funding to respond to the ongoing opioid health crisis. And indications are that federal funding, that additional federal funding for opioids and stimulant use disorders will continue for at least another year or two. That hasn't been made official yet. That will require some federal action budget, but it's everybody's expectation that will continue because the health crisis is. So flat funding is always a challenge for us because our costs continue to increase. We have increased rates with our providers as they cope with shortages in staff and challenges in retaining staff. We also have an additional challenge that we're starting to experience this fiscal year. With the end of the public health emergency, medical assistance has reinstituted its re-enrollment process. And we've just come to the end of a 12-month process. As a reminder, all during the COVID, anybody who had medical assistance retained that medical assistance. So we've had people that have enjoyed medical assistance coverage for 3 years. And even if they got a job, got private health insurance, they still kept their medical assistance. That is no longer the case. And so we do have more people relying on us as the funder of last resort cost of treatment. So the demand for our services are increasing. And of course, like the rest of the world, our costs are increasing as well for staff, for benefits, costs overall. So that is going to be an ongoing challenge for us. We did have one piece of good news this fiscal year. We're given the opportunity to request additional funding from our state agency midway through the year. Some years they say no. This year they said yes. And so that was fortunate. But it's only one-time funding. So it's only good for the end of this fiscal year. But that's just to mention that there are those opportunities. We always look under every rock for additional funds.
Appreciate that, Doug. Do you know how much you're thinking about requesting for that, given once they've opened that door?
You've already
requested
and received. What did we get right this year?
It was 273,000.
Okay, great. And then the
And
opioid.
mostly that is for treatment and recovery support services. It's limited, but we're allowed to use it.
Sure.
We can't just It's not flexible money that you can plug into any gap.
Okay. And then you indicated the flat funding, but is the opioid trust funding running through your budget?
No.
No. Okay.
We've set up separate accounts for that in the county system. And I think those accounts are set up on a calendar year basis. So they're actually not part of this budget.
Okay. Because I noticed it appeared as though there were increases in state grants, but it may be the additional money that the 200 and some that you're getting. Okay. Very good. And I think some of your comments could be applied to all of the departments here. Increased costs, staffing issues, providers increasing their costs. So might be it's a common theme.
Any more questions for drug and alcohol? Then we're gonna move on to children.
So for our county budget for fiscal year 24-25, the way I developed that is I use our needs-based budget, and this year we got our certified numbers before the county budget was due, so I was able to input those numbers. The state certified us at 29,274,834, which is 0.7 less than we requested, which was a great number. So basically it was only 205,000, almost 206,000 that they didn't certify us. And I anticipate the big drivers being our salaries and benefits and our purchase services, with the congregate care being the most expensive, and the per diems from the providers. When you have shelters and detentions being $800 and some a day, it goes through the money very quickly. But overall, I think we're certified very good for 24-25.
And certification is guaranteed.
There's only one time I remember that the state came back and reduced our tentative certified numbers before we received our final, and that was probably about 10 years ago.
Yeah.
Okay. And it wasn't a huge decrease. It was mainly like we said you can get this position.
Mm-hmm.
We filled it, and then they said, nope, we're not going to certify you for that position. But it doesn't mean that if we do go over certification that they won't make us whole on the back end if there's still state funds available, which since I've been here 28 years, there's always been funds, but that number's decreasing, but so far so good.
We've seen a real change in our department. We're actually seeing placement numbers are coming down a little, but our in-home services have exploded. The amount of cases that the in-home workers right now. Again, it's kind of a double-edged sword. We're working with families in their home. That's a great thing, but the numbers have really gone up very, very much. And so the workers are probably soon going to be coming forward with some positions for that.
Adapting to the changes.
Yep.
That's wonderful. Thank you.
MHRD? Should we ask them?
I will just, I'll ask Linda to share much of it. I'm going to stand up so I can see everybody. As we all know, the governor proposed last year an additional $20 million for statewide mental health services in county base. And for Cumberland and Perry County specifically, for us, that amount equated to $354,000. This year's budget proposal included an additional 20 million. So based on the current allocation structure, we can probably anticipate another $354,000. But we know that just like all of the other departments, our expenses continue to rise. The number of individuals seeking services has also risen. And similar to what Jack shared, due to the ending of the public health emergency, we anticipate there will be others coming off of the Medicaid rosters seeking funding from our offices. So we're watching that closely. We're also watching our providers' budgets very closely, as well as staffing, and trying to stay abreast of staffing needs, staffing issues. One of the programmatic struggles that I think I've observed is that as we have new staff, especially like in our residential services where people almost become like family and they're used to having meals together, and staff
know the people they're serving. Because of higher turnover rates, they don't know the people they're serving. And whenever there's a problem that arises, a behavior that may arise, they don't know how to intervene and be successful. So consequently, we've also seen an increase in incidents, people going to the emergency department because somebody has argued with a staff member and they don't know how to mitigate that kind of problem. So, we've had incidents where, one of our staff has actually gone out maybe late day on a Friday because somebody is concerned about another person in one of our programs. So we've seen more of that kind of situation also arise, sometimes because of staffing issues. I've even gone out like on a Sunday afternoon to a program just to check in, just to see how people are doing. But that's, again, the impact of flat funding or $354,000 as an increase when we know our expenses are exceeding much more quickly than that. So those are some of the struggles we're seeing, and largely flat funding. We have also had increases in the sense that we've had opportunities, I'll say. We are currently working on a regional LTSR, a long-term structured residence program, working with Franklin County. Due to a lawsuit settlement with the state, the American Civil Liberties Union filed lawsuit with the Commonwealth of Pennsylvania because of the length of time it takes to get people from prison to a forensic state hospital. So that will actually be added into our allocation. Linda will talk about specifically that portion. We've received part of those dollars. I believe we've received like 1.4 million thus far. Our request was 3.9 million for startup and 3.2 million as an operational budget, because we believe it's going to cost more to start the program than it will be to continue to operate. Plus the people who are receiving services there will also pay rent. So they'll also help to support the program. So that's one positive that we have currently that we're working on. The other maybe positive, we're hoping, is the Emergency Behavioral Health Crisis Walk-in Center. So as you folks are aware, that was a $13+ million grant, as well as 5.5 million in Health Choices reinvestment dollars to do the renovations to the property. One of the biggest questions that we have is sustainability. And I just this morning was in a meeting with the state about the sustainability of the project. So more to come on that. We're looking largely on the Health Choices side of Medicaid to try to see what creative ways we may be able to help support the program. And if we had the crisis regulations that we were hoping to have by now, we would have also been asking our provider, Connections Health Solution, to be working with private insurers so that we could influence parity and make sure that people's mental health services were paid to the same level as our physical health services. But because of the lack of the ability to have that new licensing regulation, we're a little stuck. So we're going to continue to work on that. Again, like Jack said, leave no stone unturned to try to make sure that we're looking at all angles for sustainability of the project. We think it's a very important service need for our community because we know that people with behavioral health crisis show up at our emergency departments, sometimes get stuck there for days, sometimes then get released and still struggle. Sometimes they're arrested, sometimes they're homeless. And we believe if we could do this well, we truly could do a better job on the front side, meeting the needs of our community. With that, I'm going to let Linda talk more about the specifics about the money. Thanks, Linda.
Part of it is because we didn't know the money was coming in, and it actually came in. Some of it has come in 2024. So even though it looks like we have this huge, almost $22 million difference between our 24 budget and our 25 budget, a lot of it, almost 16.5 million of it is the regional crisis program. Over 13 million of that comes from the state, and we got 5.5 million from CABHC for startup renovations, of which I'm estimating about half of that will be spent before June, as long as everything keeps going on status quo. We're still going to have to pay the provider because they have had demolition done. They are working on this project, so we will have some bills that will come out of that money, even if we have to return it all to the state or return part of it to CABHC. The other one would be the long-term structured residential program. as Annie said, we've gotten about $1.4 million of that. It's sitting in our deferred account, but the budget was not updated. We just put a new accounting unit in so that I can track the LTSR, I can track the regional project, and at any time pull expenses for those 2 projects. So I need to do a budget resolution, which hopefully you will see coming across your desk in the next month. So, but that's going to be about 3.9 million for next year, because we have not spent any of that money so far. I did just get a letter before I came over here, told Ron I was ready to retire today before I pulled my hair out, because now they've said, we've gotten the money back from Franklin Fulton, but we're going to put that back in your 22-23 budget. And so we need you to, I have to redo my INA. I was like, really? But that money never came in. Well, I won't say that part of the money. This is the Franklin Fulton part. It was actually, they've just written the letter and I might get the money this month, they said. So, yeah, and the rest of it, as Annie's focus, is the estimating that the $300 and some thousand that the state gave us last year, that it will roll over into twice that much next year. So that is the bulk, but that is the bulk of our $22 million is the MH budget. So on EI or for ID, it's basically about 32,000, 33,000 when I broke it out, and that's because of federal billing that we can do for our admin, which how many years ago it's been now 4 or 5 that we started billing for our federal admin instead of getting these as an advance as part of our allocation. So that it has increased steadily. Of course, as our salaries go up, the amount that I send to the state goes up, and then hopefully we get that back in return. So EI has gone up about 71,000, and that's basically due to increase in services. So that is a mandated service, and we can usually always expect to get the money that we need for that program. And finally, we do have our sports coordination unit, and I estimated that will go up about 140,000, and that is basically due to the increase in salaries. It's basically, and it's billing. We do billing. If we don't have enough, we do have a restricted account that we can pull that money from to cover our expenses. So, and Sue wants to talk to anything else about EI and IDD.
So I'll just mention a few things. So I have shared with you that we did receive a mid-year waiver allocation, which was 36 more waivers, which has been very helpful in meeting our waiting list numbers. So for Cumberland area, our waiting list numbers are 238. And of that, 123 are emergency, which is where we are concentrating putting these new waivers. So in the governor's budget, he has another waiver allocation initiative in there for the counties. So we're hoping for something very similar to that for next year as well. There's also $438 million in there to increase the rates for the ID providers. So we're hoping that happens. And in addition, there was $109 million in there for the providers for staff recruitment and retention to get in May or June. And they need to apply for that though. So that is coming up. And for EI, they are doing a rate study right now. It's been a pretty intense rate study. They're doing time studies for both the providers and the SCs, and talked to Linda and they've talked to all our staff. So we don't know much about that rate study yet, but we're hoping that comes out very positive as well for EI.
Thank you, Sue. I do have a couple of questions, and you've answered the biggest one because the state funding looked like it was up about $18 million, and where did it come from? Thank you for saying where that's allocated. On a couple of those projects, though, Annie, if they're construction, are the construction costs, have we locked those in, or could we see where this funding isn't adequate to complete the projects involved?
Well, the funding for the construction is already under contract.
It is contracted,
They've already
okay,
done the demolition work. In fact, just earlier this week, we found out they actually got their building permit.
okay.
So very soon, they're actually going to start the renovations. We believe there's enough money out of that 5.5 million from the Health Choices program to cover the cost of the build out. And then we're going to use the grant, 13 million, during the actual startup. So onboarding of staff, providing services, as well as then, you know, getting credentialed with insurances. You know, we're trying to make sure that, you know, the whole program is going to be sustainable, but there's still a lot of unanswered questions at this point.
Yeah, and then on the long-term structured residence, that project, is that construction as well?
We don't know yet.
Okay.
There will be construction involved because this is a licensed program. So it's going to have to meet the regulation standards. Typically LTSRs are locked programs. And given the population that we're talking about serving, we want this program to be locked as well. So given it's a shared program with Franklin and Fulton counties, we are anticipating hopefully that we can find something toward the western end of the county, down towards the Franklin County line, perhaps in Franklin County, but it just depends where we can secure property, either land or find a building that would meet our needs. Our current LTSR has just under 11,000 square feet. So if anybody's aware of a program or a building that might be vacant for sale, you know, that would be awesome. But yeah, just to, you know, try to answer your question. And then our annual budget will be increased by $3.2 million to sustain the operation of the building, of the program.
And then from one of the providers, I did receive that ODP is a new initiative from the performance-based contracting for residential service providers, and they're very concerned about this. I think they don't have the metrics, and they're a little they're concerned that this is going to increase costs. Are you guys hearing that same thing?
Yeah, so there's not a lot out on that yet. There are webinars coming up for providers for the AE, for the SEO, for the individuals and families, and for any other stakeholders. And they're going to happen here at the end of April, beginning of May. That's the first step that they've done. And we know that there's a lot of training coming for us down the pike here. But they haven't shared a lot yet. And that's probably where all this is coming from. And I don't blame them, you know.
They're concerned. And the staff recruitment bonuses, I got the impression that was part of that performance-based metric as well, but I could be very wrong on that.
You mean 109 million?
Yeah.
That came out of some of this last year money that they found. So that
they found. Can they find a little for us more, you know? Where they want it.
Yeah, they found it. So they have to them. But they're going to have to apply for that.
Okay.
And they will have to meet the guidelines and submit what exactly they have to submit in order to get it.
Okay.
And as we all know, sometimes that can be fun too.
Right. So Sue, my concern, and based on what they were saying to me, is that they don't have details now. They believe it's going to increase costs, and will providers start to shrink again, where we have fewer and fewer providers to supply these services. So
they are afraid that performance-based contract is going to start to roll out some of our providers, some of the smaller mom and pop like providers, your big providers like Keystone and those kind of providers. I think C Park will survive, UCP will survive here in our area. But some of the really small ones, it's going to be based on quality performance. It's going to be based on quality measures. The more that they can find as far as being able to do something creative to have staff retention and be able to offer staff some kind of bonus and some kind of maybe credentialing of staff. That's in there. To have nurses, to have behavioral staff on site, instead of that having to be another service that has to be purchased. Those kind of things.
Sounds good. I just think, when you say performance metrics, those can be great in helping to make sure that the quality of service is improved. Or, some state metrics can be nonsensical. So I think it's a concern that
But it is to get quality services for the individuals. The more they can get, it's supposed to be like a tiered like program, the more services that they have in the first tier, they're gonna get a better rate. Because some of your smaller providers aren't gonna be able to hire nurses, aren't gonna be able to hire behavior staff and those kind of things, and they have more trouble keeping staff. They're the kind, the providers that probably maybe in a year or two will drop out of this. And that's what I think people are concerned about. How many providers we will lose because of that.
And if you are providing more extensive services, the costs are going to be more expensive.
Exactly.
For those services,
So I will share more information as I get it, but it's been sketchy for us too.
Okay. Thank you, I appreciate that.
You're welcome.
And then our last department is criminal justice services.
My department is principally funded through the grant for the general fund, although we do receive some subsidy through the IP grant, principally for a couple of positions that are partially funded with the IP grant. Our budget has stayed relatively static. We show about a $45,000 increase, and that's principally because of the increased costs of products and services. As we talked about at our meeting, I'm doing a lot to change vendors to reduce costs and get more bang for the buck for the services that we get.
And Paul, the new vendor contract that you had shared with us, is that referenced in the budget, then the numbers from that?
For that vendor, it actually doesn't impact our budget a whole lot because we bill the referral agency for the cost of that. So even though it's an upfront cost for us, we bill adult probation or children youth or juvenile probation for that service, and so it doesn't
hit yours.
Doesn't hit us.
Okay. Right. But we're working it through Dana and everything. Okay. Getting nods from the other departments affected. Very good.
Thank you. So that was all of our departments for the fiscal budgets.
All right. Did anyone have any other questions or anything else?
I have a question, Paul, on the criminal justice services revenues funding source. I see that that grant 410 in 2022, 400 in 2023, 282 in 2024. Which grant is that, please?
That would be some of the funding we had received for the for OIC.
Okay. Thank you.
And that went away.
Thank you.
Are they talking about bringing it back? It was $122,000 increase.
I don't think so. It was like a startup. Yeah.
Any other questions of the folks?
Yeah, I did just think of one thing. I guess I'm going to direct that to Dana because my knowledge of this is maybe a little faded, and maybe Annie as well. Because I think it was Department of Aging, but we had a situation a number of years back where there was a pending lawsuit in regards to some monies that were being held just kind of like in limbo and awaiting some type of determination. I think it was aging.
Yeah.
Okay. Has there been any forward movement on that? Because, I think the hope was that we would be able to eventually claim at least a part of that. Whoever has the answer.
Actually, it's been claimed. We paid back the general fund everything that you had given us, and then what was remaining of that went into our funds to pay bills that are coming up. So the aging side received $200 and some thousand of that, and the community services side received the $900. But we paid back the general fund for all the subsidy we had used out of that. Okay. So that fund is completely cleared out, zeroed out now.
Okay, all right. Dana, is that the same thing that
Yes.
Do you recall anything else? That's the correct issue.
Yes.
Okay, so that's resolved. We've gotten what we're gonna get. All right, that's great. Thank you.
Anything else? All right, folks, thank you very much, everyone. Is there any other business to come before the board at this time? Hearing none, I'll entertain a motion for adjournment.
So moved.
We're adjourned.